Well, good evening. Kirk Euler back with you. I hope you all are having a nice Saturday, good weekend. Everything's working out well for you. Just wanted to check in on the numbers again. And you'll recall last week I did a video about the difference between hospitalized with versus because of. And evidently that was controversial enough to where the Sacramento Bee, the major Sacramento daily newspaper, the Sacramento Bee decided they needed to fact check me to make sure that I wasn't making something up or that this was really the case. Spoiler alert, it's true. Anyway, they decided they needed to fact check me, and I was almost reluctant to do this because as of today that video has been viewed almost 400,000 times, and that's about 4 times their daily subscription. So I kind of didn't want to give them the publicity, but they were so egregiously wrong in how they went about doing what they're doing. I thought it was an important study in how the media continues to try to manipulate the data. And we all know how much I love the data. So how they continue to try to manipulate the data into saying things that it just simply doesn't say. So let's go ahead and jump into this again. Fact check. Dun, dun, dun. Are California hospitals overcounting coronavirus patients? Yes. Okay, done. You'd think we could just end it right there, right? Nope. So they go ahead and they jump into, they quote me in the video, and they say, Euler's primary contention, I love this, Euler's primary contention, California hospitals count patients admitted to their facility who have COVID-19 even though they may not have been admitted for symptoms of the disease. While that's true, that was a main point that I made. The reason I made that point was to get at what came at the end of the video, and that is the metrics that Newsom is using. You remember at the time I did that video, we were on the verge of being shut down. He hadn't shut us down yet. And what was I concerned about? I was concerned that his metrics were completely faulty, because what he was measuring us against, number one, was nothing that we had that we had any control over. That's number one. And number two, the fact that the with versus because factors in significantly if you actually care about crafting effective public policy about public health. If you're not able to distinguish hospitalizations with as opposed to because, you have no idea what you might be doing that is or is not impacting your hospitalization rates. So, with that as a backdrop, let's jump into this. So they go on to quote me, not a single county in the state can tell you they know how people are hospitalized, or excuse me, how many people are hospitalized, how many people are in the intensive care unit or dead because of COVID as opposed to with COVID. That was my quote, and that is true. Fact check so far, Euler's right, so far. But I love this. The very next paragraph. The claim, now it's a claim, it's not an assertion of fact, which it actually is. They're saying it's a claim that hospitals can't tell you the difference between with and because of. The claim is part of a national web of conspiracy theories that have taken hold throughout the coronavirus pandemic, sometimes coming from the Trump administration. Simple question, honest question. How can it be a conspiracy theory if it's true? And it is. And they even go on to admit it. Very next line. Experts say Euler's theory, no, it's not a theory, it's the fact. Euler's theory, like any widespread conspiracy theory, is rooted in a kernel of truth. Guys, Sacramento Bee, it's not a kernel. It's the whole damn stock. All right, the whole thing is true. Every point I made is true. And in fact, your very next sentence, you even have to admit, he's not wrong about hospitals reporting all infections to the state, as opposed to the because of reporting the with. he's not wrong. You know, there's another way of saying he's not wrong. He's right. That is how you say somebody's not wrong. You can say they're right, and that's how you say it. But we couldn't do that because it'd be a really short story if we did that. So they go on to say, you were first attacked the numbers at last week's Placer County Board of Supervisors meeting. Well, anybody who has been watching these videos or paying any attention to our Board of Supervisors meetings for the last 2 months knows that that's horse hockey. I've been questioning the numbers for over a couple months, but let's not let that distract us. In fact, they go on to quote our own public health officer, Dr. Sisson, who when I asked her, are they distinguishing between with and because, she actually said, we've raised this issue with the state. I'm hopeful they'll begin asking hospitals to track the data separately. Why? So we can make good public health decisions based on what? The data. So, in fact, on that day, the day of the board meeting where I'm asking these questions, we had 12 people that were hospitalized with COVID, 3 of which did not have any symptoms, 3 of which were completely asymptomatic. What that means is on the day that I was asking these questions, which they feel the need to fact check, on that very day, 25% of the people hospitalized were not hospitalized because of it. They were found out to have it because they were hospitalized for something else. How do you make good public policy decisions when 1/4 of your data set is faulty? That's the point I'm trying to make. Anyway, they go on to write, the Sacramento Bee goes on to write, the state for months has required hospitals to report the number of people who are hospitalized for any reason who also have a laboratory confirmed case of COVID-19. Completely false, guys. And if you'd even seen the video I did or bothered to investigate the CARES Act, you'd know you don't have to have a laboratory confirmed positive test in order to count somebody for COVID. You can have presumed cases included in that number. But far be it for the Sacramento Bee to actually want to check that fact. The California Department of Public Health said the reason a COVID-19 positive patient was in the hospital wasn't a factor in their reports. So, fact check, Euler was right. Why they were hospitalized wasn't a factor. Just that they were positive was the fact. So, fact check, I'm right. Okay. Jan Emerson Shea, a spokeswoman for the California Hospital Association, said it's not misleading for the state to ask hospitals to report all COVID-19 patients. I never said it was misleading. I said if you want to craft good public health policy, you have to know who is being admitted because they're sick with the disease as opposed to who's being admitted who happens to have the disease. That's how you craft good public health policy. Anyway, they go on to quote some of this. Is fascinating to me. State health officials aren't just using the numbers to determine how many beds are free. They're using hospitals as a barometer to help monitor COVID-19 infection rates in communities, said Arthur Kaplan, director of the Medical Ethics Program at New York University's Langone Medical Center. So, first of all, you can't find an expert in California. Second of all, you travel to the epicenter of the outbreak in the United States, New York. That's where you're going to go find your expert to start talking about how you need to be able to predict the COVID numbers. This Kaplan said those numbers about hospital infections and ultimately ICU space help if you want to know if, quote, if you want to know if the outbreak is going to get worse. That's precisely my point. If you don't know who's being hospitalized because they have the disease and are sick from it, and therefore need the available hospital bed capacity or ICU capacity, if you can't distinguish that versus those who are total hospitalized, with it, you can't create exactly what it is he's calling for. So I don't know how this stands up to any kind of sense here. Sacramento Bee reached out to several hospital chains around the region. None were willing to comment because they cited privacy issues, blah, blah, blah. Anyway, bottom line is simply this. The fact is, and it is the fact for those of you at the Sacramento Bee, the fact is no one can tell you what the actual number is of those who have been hospitalized in the state of California with the disease as opposed to because of the disease. Nobody can tell you the number of people who have died because of the disease as opposed to with the disease. And in fact, the metrics, and this was my point, the metrics that we as counties are being measured against have no relevance to that. What we are being measured against is our hospitalization rate, number of people with, not because of, so that's very important, that does have it, but our ICU capacity, and this is the part that chaps my hide beyond belief, because at the same time that we are shutting down our businesses in this county and in this state, with absolutely no idea whether or not that shutting down is going to have any positive impact from a public health policy standpoint, because we don't have the right data set to compare it against. At the same time we're doing that, you're going to fault the counties like Placer County because the hospitals are doing what hospitals need to do, and that is admit people so they can make money and stay in business. What's my point? We're being measured in Placer County. One of the metrics we are failing right now is our ICU bed availability. The state is failing us, and therefore our businesses have to shut down because of our ICU bed availability. They say because we have less than 20% availability of our hospital beds, we fail to meet the metric. Ladies and gentlemen, as I'm talking to you right now, in Placer County, we have 8 people in the ICU. Total bed capacity, 140 beds. 8 are in the ICU, but wait, it gets better. Only 3 Placer County ICU beds are being taken up by Placer County residents. 140 beds. 3 ICU COVID positive Placer County residents taking up those beds. And yet, because hospitals are businesses, they want those beds occupied so they can make money. We are being dinged, and mom and pop shops across this county are going out of business, laying off employees, losing their lives, their livelihoods, and their fortunes over faulty metrics. That was the point, Sacramento Bee. That was the point of that video. And the fact check is true.